name's Megan. I'm one of the student athletic trainers.
Hi Megan, nice to meet you.
So I see on your records that you had a distal tib-fib fracture from football. So I'm just going to ask you a couple questions about your history. So what happened again? What type of imaging did you have before surgery? When was your surgery? And what was involved in your surgery? Did you have rods, pleats? How has your sleeping been? Do you have more pain in the morning or at night? What type of medication have you been prescribed? On a pain scale of 0 to 10, can you rate your pain for me? When was your cast taken off, and when did you get off crutches, and when do you see your surgeon next?
Okay, I'm just going to observe your legs and kind of compare bilaterally to see any of the differences. Your incision sites look pretty good. We don't see any infections. We don't have any discoloration, very minimal swelling. We have some serious atrophy though. I'll go through and just palpate. Alright. Are we a little tender here?
Just over where my incisions are.
Incision. But there's no pain, right?
No.
No, nothing along here.
No.
How about in through here?
That's fine.
Fine. This side too?
Yep.
And all through the foot we're okay?
Yes.
I'm just going to check your circulation by checking your cap refill, and we have some good return there.
So next I just want to check your ankle range of motion since your injury was distal. That's the joint that's been most affected, especially since you've been in a cast for 6 weeks and now in a walking boot. A lot of your musculature is definitely weak and tight, so I want to check that too. Can you point both of your feet down to the ground? Okay, good. Now can you go the opposite direction and point them up to the ceiling? Okay, good. And now I'm going to have you point both of your toes towards each other. Yep, and now bring both feet the opposite way, so pointing out. Okay, now I'm going to do some passive range of motion, which is going to just be me doing it, so don't try and help me. As I move through, just let me know when it comes to a point where it's discomfort. Okay?
Yeah, right there.
Okay, that's the farthest you can go?
Mm-hmm.
Okay, now I'm going to come up.
Yeah, like right there.
Okay. That bothers you?
Yeah.
Okay, and then last one.
Yeah.
Okay, and then I'm just going to check on both sides.
Okay, now I'm just going to check some measurements for your ranges. Okay, and go ahead and bring your toes to your nose. And go ahead and point your toes to the ground. Okay, so go ahead and bring your toes in. Alright, and bring your toes out. Now I'm just going to do the same thing on your uninvolved leg.
Okay, so now I'm just going to check the strength of your muscles. I'm going to do your uninvolved side first, and as you're pushing up or out and down against my hand, I'm going to apply some resistance, and then I want you to hold it there and don't let me push down on the limb, okay? So you're going to bring your foot up, keep going, keep going, keep going, keep going, hold it there. Okay, good. And then you're going to bring your foot down, keep going, don't let me push up, good job. And then you're going to bring your foot out, keep going, hold it there. And you're going to bring your foot in. Good job. Hold it there. Okay, and then I'm going to check your involved side. So you're going to bring your foot up. Keep going. Hold it there. Okay. Bring your foot down. Hold it there. Then in. Keep going. Hold it there. And last one. Bring your foot out. And hold it there. Okay, good. Your sensation and nerves and make sure that everything's intact. It is normal for your incision sites to be a little numb, but I just want to check everything else. So Does this feel the same as that?
Mm-hmm.
Okay. What about that and that?
Oh, just near my like incision site.
Okay. Okay. How about that?
It's the same.
Same? Here?
Just in that same spot. Okay, so now I'm just going to take some girth measurements. Starting at the mid-patella, we measure 10 centimeters down and then every 5. This way we can compare the uninvolved leg and the involved leg, and we can see how much muscle mass was lost, and then we can track your progression as your rehab plan continues. And just based on those measurements, you have a significant muscle mass lost on your involved leg. So now I'm just going to check the girth measurement of your ankle just to see if we have any residual swelling. I'm going to do your uninvolved first. And there doesn't appear to be any swelling left.